My name is Bat-Sheva Maslow. I'm a reproductive endocrinologist. I work at Extend Fertility, which is a full-service fertility program in Midtown Manhattan in New York City. As many of you, I'm sure, know, most fertility programs have put their services on hold. I want to take a chance to really talk about how fertility can be viewed during this time for people who are starting to think about conceiving, those who are on a fertility journey that needed to either stop before it ever got started or kind of get halted in the middle. We're going to try and kind of touch upon all of those things. And so really the goal here is to be able to empower everyone to be educated and informed as much as we can. And think about all the options that are available so that we can make the most of the time that we have while we're waiting, and that as soon as things can get settle down and we can pick up again, that we're all ready to hit the ground running. What can we do to prepare during this time so that when we do restart our plans and do restart our attempts at conception, that we're ready and our bodies are well prepared? The first is to think constructively about our reproductive goals. And I tell all of my patients this. So many of you may know that in my practice, I see a lot of women who are interested in fertility preservation. And one of the things I really push them to think about is, what are their reproductive goals? What kind of family are they envisioning? That's something that couples can think about too. This is a perfect opportunity to think about, well, what are my goals? What would I like my family to look like? Am I sure I want a family? How many children do I want? What is the spacing I think about? It's really nice to have a set of goals that you're looking towards so that you can make decisions that help maximize the opportunity or optimize the opportunity that those goals will be met. Knowing that we're going to need to be flexible and we're going to need to recognize that most of this, especially when it comes to reproduction, is out of our hands. The next 3 things on my list of things we can do to prepare are pretty practical. So prenatal vitamins. Prenatal vitamins are available over the counter. You don't need a prescription. They're all basically the same. And prenatal vitamins are critical in terms of making sure that women have the right nutritional makeup before pregnancy. In an ideal world, you'd like to be on prenatal vitamins for about 3 months before you conceive. So for those of you who are just starting to think about potentially conceiving, starting prenatal vitamins now is an opportunity to kind of get a leg up on a healthy pregnancy in the coming months. The next is smoking. Now, smoking is one of the few things that we know that really can significantly impact fertility, both male and female smoking, almost male smoking even more than female smoking. And so if you are part of a couple and you're thinking about conceiving and one or both of you smokes, now is the perfect opportunity to stop. And for men, any lifestyle modification that they make in order to improve sperm count takes about 90 days to really be demonstrated in the sperm. So right now, if a man is smoking and that's impacting his sperm, if he stops, 3 months from now is when he's going to start to see that real benefit. Plus, we're talking about, we're in a global health pandemic that is a respiratory illness, and smoking is going to put you more at risk for having a worse outcome in terms of this disease. And so both from your future reproductive standpoint and from your current health standpoint, if there is the kick in the pants that you need to quit smoking, I would say now is the time. And the last for this piece of what can we do physically to prepare is thinking about our diet and exercise. Now, there are those who have used their quarantine time to really bump up their exercise routine. Personally, that's been very challenging for me, and I'm sure there are many like me. For those who are thinking about conceiving or who are on a fertility journey, whatever you can do, both men and women, to keep your body as healthy as possible is going to reap benefits down the line in terms of attempting to get pregnant, getting pregnant, a healthy pregnancy, physical activity, a healthy diet. It's almost more important for men than for women, but it's super important for both. And again, it takes some time to really reap those benefits. And so now is kind of the opportunity to prepare yourself if down the line you're expecting or hoping to conceive in the next few months. For those who are thinking about conceiving in the future but haven't actually started, tracking your menstrual cycle may be something that will help you. There are many free fertility apps tracking. They're mostly tracking menstrual cycles. They work best for women who have regular menstrual cycles, but they're available and helpful even for women who may not have regular menstrual cycles. The other tool that I've utilized with some of my patients is something called the AVA bracelet. As a disclosure, I sit on the medical advisory board for this company. It's a FDA approved wearable device that tracks biometric feedback, so heart rate, skin perfusion, temperature, and uses the data to calculate and alert you to the days that you are ovulating. So it's very helpful to learn a lot about your menstrual cycle, and so that's also something that's available, and maybe this is the time that someone might want to explore that. What about those who are in the middle of a fertility journey? What can you think about? What can you do? What can you use this time for? So the first and maybe second, third, and fourth thing would be financial planning. Finances are the thing that really stress people out when they're doing, when they're on a fertility journey. Even those who have insurance coverage, that insurance coverage is complicated. It's sometimes hard to understand. And in the midst of a journey where they're doing one cycle and this cycle, and there's all these recommendations, and you don't want to miss anything and you don't want to be late, that's a real stressor. Now we have sort of this forced moment in time where we have to take a step back. This is the time to really think about, financially, what can we do so that when we are ready to move forward, we don't have any financial delays. We are set, or you don't find yourself in a financial surprise. So if that means getting a really good handle on what's covered by your insurance, discussions with pharmacies, costs, calculating costs, savings, all that stuff, especially in a time period like now where there's a lot of financial uncertainty, being able to make sure you have an idea of what's happening in terms of your financial health so that when this crisis is over and we can move on to continuing that fertility journey, that you're not in a situation where the finances catch you by surprise. So that's a huge piece, and it's not fun and it's not cool. But practically speaking, I think could be a tremendous help for people who are in this and want to look towards the future. What else can we do to kind of move our fertility journey forward? So for those of you who haven't yet had the opportunity to meet with a fertility specialist or set up a plan, but we're about to, or think you might need one, many of my colleagues are having phone or video consultations. So I personally, in my office, myself and my colleagues are doing all telemedicine to be able to at least start the conversation with the physician, give the physician an opportunity to start thinking about what might be wrong, thinking about what tests they may want to order. Some of those tests can still be done. And so getting that first foot in the door can still be done. In addition, there are some other testing that can be done at home that you can order on your own. You could have home AMH testing. So AMH is a hormone that is our best tool to understand egg supply. We know that women's egg supply declines with age. It is one indicator of how someone may do with fertility treatments. And there's a company called Modern Fertility that we've worked with in the past. There are kits for home semen analysis. So if there's a concern for male factor in fertility, you can actually get a pretty reasonable assessment of sperm count and quality at home with a test kit. So that company's called Legacy. There are a few of them, but that's one that I've utilized in the past. And so those are options that can at least get the fertility journey started during this time period. I'm getting a lot of questions about when will this be over, and honestly, I wish I knew. We don't know exactly how things will unfold and when it will make sense and when it will be safe to proceed. I can tell you that all of your physicians are in this with you. None of us want to be sitting at home. None of us want to not be treating our patients. As soon as we're ready and as soon as this is better and we have some more clarity, we're going to get started again. And we're going to be here to make sure that we've supported you and that we are going to see the successes that you all deserve. We're going to get to the other side of this.